Hello and welcome to I Didn't Know. Get ready to have your world turned upside down as we debunk 10 medical myths. Hold on tight, it's going to be a bumpy ride. Number 10. The truth about thirst. The conventional wisdom of needing to drink 8 glasses of water a day doesn't hold water, according to the Mayo Clinic. While hydration is undoubtedly crucial for our bodily functions, the actual amount needed varies significantly from day to day. Whether you've been sweating in the heat or taking a leisurely day indoors, your water needs adjust accordingly. Your dietary choices also come into play, as water-rich fruits and vegetables can reduce the need for additional water intake. So instead of rigidly sticking to the 8-glass rule, heed your body's thirst signals and prioritize water as your go-to thirst quencher. The origin of this myth? A 1945 recommendation that's often misinterpreted. Omitting the crucial detail, most of our water intake comes from prepared foods. Number 9. Spice up your life without fear. It's a widespread belief that spicy food can trigger stomach ulcers, but this claim doesn't have the CDC's endorsement. Rather, it asserts that approximately 80% of all stomach ulcers are linked to Helicobacter pylori, a bacterium sometimes found in the digestive tract. Other culprits are chronic or excessive use of anti-inflammatory medications. Factors like stress and smoking can exacerbate ulcers but aren't primary causes. Spicy and greasy foods may aggravate an existing ulcer, leading to increased discomfort. This could cause people to mistakenly believe that such foods are the cause. This myth may also stem from the old notion that spicy components could burn the stomach lining, a belief that has been scientifically debunked. Number 8. Catch those Z's, concussion or not. A concussion is a mild brain injury, usually caused by a sharp blow to the head. This results in a jarring motion in the brain, disrupting its function. But contrary to popular belief, it's not harmful for someone with a concussion to get some sleep. It was once thought that people with concussions should be frequently awakened or not allowed to sleep at all. Out of fear, they might slip into unconsciousness unnoticed. However, rest is a crucial part of healing, and frequently interrupting sleep or forbidding it altogether would actually hinder recovery. Unless advised otherwise by a medical professional, a good night's sleep could be beneficial for someone with a concussion. Number 7. Unlocking 100% of your brain? Not so fast. The widely accepted idea that humans only use 10% of their brain is more myth than fact, according to neurologist Dr. Barry Gordon of Johns Hopkins School of Medicine. Our brains are incredibly complex organs, controlling everything from thoughts, memories, and emotions to basic bodily functions like breathing and temperature regulation. While it's true that not all areas of the brain are active at once, they do get their turn to work, depending on the activities we're engaged in. This 10% brain usage myth has persisted for over a century, despite substantial advances in neuroscience. Far from being an untapped reserve, every part of our brain has a purpose, contributing to the marvelous complexity of human cognition and behavior. Number 6. Postmortem manicures? More myth than reality. This slightly macabre myth that our fingernails continue to grow after we die has been propagated by sources ranging from literature to late-night talk shows. However, this is a classic case of fiction being more appealing than fact. Forensic anthropologist William Maples refutes this idea, stating that nail and hair growth require complex hormonal regulation that simply doesn't persist after death. The illusion of growth actually arises from the dehydration of the body, which leads to skin retraction, making the nails and hair appear longer. It's an eerie image for sure, but the truth is our bodies cease their growth functions once we pass away. Number 5. Period protection. Don't bet on it. It's a common belief that a woman can't get pregnant during her period, but this isn't necessarily the case. As Dr. Alexis Melnick explains, menstrual cycles can vary in length, meaning ovulation can occur earlier than the typical day 14. Since sperm can survive for up to 5 days in the female genital tract, if ovulation happens after bleeding stops, conception is possible. Additionally, mid-cycle bleeding can be mistaken for a period. The takeaway here is, if a woman does not want to get pregnant, she should use contraception throughout her entire cycle, not just outside her period. Number 4. Exercise-only diet? Think again. Have you been relying solely on a rigorous exercise regime to shed those extra pounds? Well, it's time for a reality check. While the importance of exercise for your heart, muscles, bones, mental health, and overall longevity cannot be overstated, the effectiveness of exercise alone for significant weight loss is questionable. As Dr. Rekha B. Kumar from New York Presbyterian/Weill Cornell Medical Center asserts, the secret to long-term weight control lies in combining a calorie-restricted diet with regular exercise. Regular exercise is more important in maintaining weight after substantial weight loss. So, be mindful. Balance is key to sustainable weight management. Number 3. Expired meds, friend or foe. Do you hesitate to use that bottle of ibuprofen that expired a few months ago? Well, it turns out that hesitation might not be necessary. The expiration dates on medication bottles are a requirement by a 1979 law, indicating the date until the drug manufacturer can guarantee full potency. However, a large study by the FDA showed many medicines remain effective well past their expiration dates, with some lasting up to 15 years. There are exceptions, such as antibiotics or insulin, where dosage accuracy is critical. For most medications, though, even those expired for a few years are generally safe to take. Number 2. The silent predator of hearts, gender blind. Here's an eye-opener. Heart disease, the leading cause of death in the United States, is not the exclusive territory of men. While men tend to develop heart disease earlier in life, women are not far behind, especially after menopause when estrogen levels, which offer some heart protection, drop significantly. Postmenopausal women should proactively discuss their cardiovascular risk with their doctors. Shockingly, heart disease claims more female lives annually than all forms of cancer combined. But the good news, many risk factors are modifiable, and early detection and treatment can help prevent the majority of heart attacks. Number 1. Cold weather hot myths. Contrary to popular belief, chilly weather itself doesn't cause sickness. Although people tend to fall ill more frequently during the colder seasons, it's not the cold weather that causes these illnesses, explains Dr. Judy Tung, chair of medicine at New York Presbyterian Lower Manhattan Hospital. The seasonal nature of certain viruses like the flu, combined with people spending more time indoors during cold periods, fosters viral transmission. In fact, most upper respiratory infections are caused by viruses. Exposure to these viruses and your immune system's ability to combat them determine if you fall ill. And that's a wrap on our myth-busting journey. Remember, just because something is widely believed doesn't make it true. If you enjoyed this video, please like, comment, and subscribe. Thank you for watching.